A pair of hospital unions representing frontline staff in Northern Ontario are demanding that hospital administrators and the Ford government do more to combat violence against healthcare workers. A recent poll of 2,300 frontline hospital staff found an alarming pandemic surge in physical and sexual violence directed toward them. Kurt Black has the details.
During a joint virtual news conference this week, the Canadian Union of Public Employees and Unifor outlined the results of an Oracle research poll that looked into increases of workplace violence towards frontline healthcare workers. And to say the findings were disturbing would be an understatement. Oracle said that 78% of racialized workers had experienced harassment or abuse due to their background. 53% of workers had dealt with some sort of sexual harassment, and 28% reported an increase in the use of guns or knives, while over half of respondents reported their hospital did nothing to address their safety concerns. And though some Northern Ontario hospitals have started a campaign to try to correct the issue, in the eyes of Unifor Healthcare Director Andy Savella and QP Secretary-Treasurer Sharon Richer, the hospitals themselves must join the conversation if meaningful change is to occur.
Hospital management needs to be held accountable for our toxic environment where women are beaten, sexually assaulted, and racially attacked by hundreds every single day.
But I think that they have to join us in speaking out about, the lack of healthcare funding and what that means in terms of having the supports and resources available to make hospitals a safe place to receive treatment and work in.
As for whether hospitals should look into beefing up security in light of the past 2 years, Savella feels nothing should be left off the table.
I don't think we could go far enough. And again, I think, everything needs to be on the table because, as we're raising today, these are very serious incidents. And with the staffing strategy and the staffing crisis that we're facing right now, we cannot be losing any more healthcare workers, particularly because they're afraid to come to work.
Kurt Black, TBT News.